Traditionally, as we all know, hair transplant as a procedure relied solely on scalp grafts for coverage of the bald area, severely restricting the possibilities of covering extensive grade baldness like grade 6 and grade 7. But today the advent of body hair transplants, especially grafts taken from the chest, from the beard, have significantly expanded the donor pool. Body grafts have today reshaped the landscape of surgical hair restoration. This remarkable revolution in the field of hair transplant has added another string to the bow to the armamentarium of surgeons who do hair transplants. Scalp grafts heretofore had been the only source of supply for covering bald areas in hair transplant. Body grafts were not even talked about 10 to 13 years back. Hence, when they became popular, they were like novelty for doctor and patient alike. And also, since they vary in characteristics as compared to scalp hair in ways more than one, they needed to be classified separately. Hence, a distinct nomenclature. They have been loosely grouped as body hair grafts. In hair transplants, available grafts are always in shortage, especially for those who have certain unique indications, the ones that are listed here. Number 1, extensive grades of baldness. Grades 5, grade 6, and sometimes even grade 7 would need body hair recruitment. Whenever aggressive hairlines are required, more number of grafts are needed. When a patient wants higher densities, at times we need to conserve the scalp grafts and hence we recruit body grafts. Interestingly, and very common in my clinic, patients who are not candidates for finasteride should go in for a sizable number of body grafts, since body grafts are not affected by DHT. Even in lesser grades like grade 3 and 4, patients have been opting for more body grafts because of this reason. Then beard restoration, sideburn restoration, eyebrow restoration, scalp burns, FUT scars, and sometimes FUE scar revision. Hair can be taken from any location in the body, provided, number 1, that the hair are terminal in nature, and number 2, this hair that we are taking matches the requirements for giving coverage, fullness, and naturalness when used with or without scalp hair. Not every area of the body may be suitable for extraction. The majority of the hair on the body, you must know, is vellus in nature, not terminal. That is not thick enough to give a semblance of fullness or to give a semblance of naturalness. Only hair on the beard, the chest, the armpits, and the back that develop as secondary sexual characteristics after puberty are the ones that have terminal hair mostly. There are many patients who have good terminal hair on the legs. I don't deny that fact, but that is a rarity. So these terminal hairs from these locations of the beard, the chest, the armpit, and sometimes the back of the torso are thick enough to meet the 3 requirements of coverage, of fullness, and naturalness. But they have to be used judiciously and placed strategically with proper knowledge of the unique characteristics of how they differ from scalp hair. No, the technique varies when you harvest body hair in many ways. There are many differences in body hair, like the angle of emergence from the skin is quite acute. Body hair are not as deeply located in the skin as scalp hair are. Also, the harvesting equipment and the solutions for storage are different. Body hair transplant procedures have to be very carefully thought of so as to increase their survival out of body. FUE is widely used in harvesting body hair transplants. There are very few mentions of FUT being used for harvesting body grafts. However, FUE techniques may vary. Some may use manual methods, others are more comfortable with motorized extraction of grafts, while few are more adept at extracting each graft with the help of a needle. There are reports of some clinics harvesting pubic grafts and axillary grafts from the armpit using the FUT method. But I personally think this is too radical, especially in Indian skin, which is prone to develop hypertrophic scarring, and number 2, keloid formation. But to each his own. Body hair vary tremendously in color, in texture, caliber, length, curl, duration of the growth cycle, speed of growth, anagen-telogen ratio, anagen-telogen duration, and predisposition to graying. All regions in the body show cyclical variation. In body hair, the anagen-telogen ratio is reversed. Somewhere between 30 to 80% of body hair are in the resting phase. The anagen phase of body hair is much shorter, a few months only as compared to several years for that in the scalp. Consequently, body hair grow shorter, body hair grow thinner as compared to scalp hair. It is only one location hair, that is the beard hair, which grows faster and longer at times than scalp hair. Body hair is also often found to curl and retain its curly nature for a long time. However, with constant grooming, this curly nature of hair from the body will gradually over time change its characteristic and blend better with native scalp hair. Body hair lie more superficially in the dermis as compared to scalp hair. Scalp hair which are anchored at the deep reticular dermis or even subcutaneous tissue. Body hair emerge from the skin surface at a more acute angle as compared to scalp hair, in which the angle of emergence is higher. Generally speaking, body hair grow in single follicular units, but there are occasions in patients where 2 and 3 follicular units exist in grafts. Since the anagen-telogen ratio in body hair is reversed, you have lesser hair in the anagen phase, more hair in the resting phase, hair that are not seen. So how do we bring these hair out, increase the anagen phase, so we have a richer harvest than we otherwise would? Well, using minoxidil lotion for about 3 months will make the anagen hair cycle longer and you will have more anagen hair to target. Also, we have ways of targeting anagen hair like pre-shaving, which I'm going to talk about later, and also harvesting using high magnification. One of the significant drawbacks of using body hair is that they do not grow as long, with the exception, of course, of beard grafts. For example, chest hair will grow only a few centimeters, so therefore they will not give the fullness, the coverage, the density that the patient desires. So this chart here shows a rough number of grafts that I do: grafts from the scalp, grafts from the beard, grafts from the chest. These are the commonest body grafts done in my clinic. And I do them routinely because I mostly get higher grades of baldness for surgical hair restoration in my clinic. That is how my practice has evolved. I've been doing body hair transplants for over 12 years now. In extensively bald patients who do not have the resource of body hair, it is very difficult to cover the whole head in one go. The patient has to be counseled that there is a limit of number of grafts that can be extracted safely from the scalp donor. Grafts that are permanent in nature from the safe zone, not transgressing the bounds of the permanent zone. He has to be counseled that such a large area cannot be covered with an area which is smaller than the bald area, and the scalp donor looking the same after the procedure. After all, it's not magic that we do. We are just creating an illusion of fullness without affecting the aesthetics of the scalp donor. So in such cases in which body hair are not available, using about 3,500 to at times 4,000 grafts, we can cover the hairline, the temple points and mid-scalp in one session, and the patient has to be patient and come in for a second procedure anytime after 6 months are over for coverage of the crown area. Sometimes even a third session is required if the baldness is very advanced and the availability of scalp grafts is less. No, in women, body hair are scanty, and whenever they are there are very few terminal hair available, and since they are not in sizable numbers, body hair transplant is never thought of in women. Body hair can be used any time that body hair become terminal in nature, and this usually happens after puberty. After 18 years to 21 years is a time when body hairs can be transplanted in given indications. However, hair transplant is usually not done before the age of 25. And this is the age when body hair are fully developed. No, body hair transplant is quite a comfortable procedure. We use local anesthetic cream for 2 hours, followed by local anesthesia. Patients usually do not report any discomfort of pain. The only discomfort that they report is the discomfort of positioning. But mind you, it is more difficult for the surgeon and his team to maintain that difficult position than it is for the patient because he's lying down. Overall, it is a well-tolerated procedure and we do it almost every day. With body grafts, the depth of the grafts varies from location to location. As the depth of the location of the grafts varies from location to location and the angle of emergence is different for different locations, the hair transplant surgeon has to constantly change his position, has to constantly change the settings of his FUE machine, has to constantly change the punches that he uses for body hair transplant so as to get a rich yield. The extraction of body grafts is more difficult, definitely, more time consuming, more back breaking. It is a laborious task. And at the same time, not even a quarter of the grafts can be extracted from the body compared to the speed of harvest when you extract from the scalp donor. As a ballpark figure, body hair grafts take about 2 to 3 times, consume about twice to thrice the time taken for harvesting as compared to scalp hair. Someone else's hair will never take because hair grafts are very immunogenic in nature and the body will reject them in a jiffy. No, we cannot take so many grafts in one session. There are reports of clinics taking 10,000 grafts in one session, but then they do not show the integrity of the scalp donor. The scalp donor is rendered useless, scarred, visibly thin, more of a problem than the baldness. Taking grafts more than 3,000 or at times more than 4,000 is well nigh impossible, for there is hell to pay. Overzealousness in harvesting from the scalp donor can lead to immense shock loss, which may be mostly permanent. It leads to scarring and poor aesthesis of the scalp donor area. Patchiness so resulting can be seen from a mile. Body grafts have a good success rate, a good survival rate, and I have been noticing this for over 10 years now, that body hair transplants is a successful method in the armamentarium of a hair restoration surgeon. Patients report a good experience as far as comfort with the procedure goes, as far as the success of growth goes, healing is quick, and surgical outcomes are optimal. However, on the flip side, because everything has a flip side to it, the graft survival rate as compared to that of scalp hair is little lesser by 10 to 15%. Whereas 95% to 100% of grafts taken from the scalp survive in my practice, only about 85 to 90% of grafts taken from the body will survive. And this is a good survival rate for body hair grafts, given the nature of being very fragile and notwithstanding increased out-of-body ischemia time. Yes, your transplanted hair will survive for the rest of your life. These hair are not DHT dependent. The only thing, with age, they will also thin over time. Shedding is a biological phenomenon. All hair after transplantation will shed. There is a small minority of patients, 1 to 5%, in whom there is no shedding seen. So let's hope that you are in this minority. The distinct characteristics of body hair that are unique necessitate strategic geographical placement in the right ratio of mixture with scalp hair so that we can ensure a pleasing, a harmonious, and an aesthetic blend with scalp hair. This requires knowledge of body hair, how they compare with scalp hair. It requires a keen eye for detail and an artistic touch. The successful integration of body hair on the scalp hinges on the surgeon's ability to balance these diverse variations, creating a natural and seamless look. The donor area in body grafts heals much faster. Why it heals much faster? Because donor area skin is quite loose as compared to scalp skin. So within no time, the wound has contracted and closed itself. And this happens very early. A patient who has had a beard transplant does not, most of the times, need a bandage, even on the day of the procedure. Also, beard donor can be shaved within 2 to 3 days after a hair transplant. And when you shave, mind it that you do not shave against the grain. Because if you do, there will be little tenderness, there will be little pain. So shave along the grain 3 days after hair transplant. And the same is true for donor areas that are not located over bony prominences. Well, the shadow area of the beard is the area below the jawline where the mandibular shadow falls. Usually this is the area not perceptible when you are viewing the patient up front. It also includes the upper neck, but the majority of the area is constituted by the submandibular region that is below the jawline and behind. So why do we do that? In Indian skin, there is always a chance, though very rare, a chance of hypertrophic scarring. So in the eventuality of this happening and remaining for about 6 months after the procedure, before it settles down, we restrict our harvesting to the shadow area of the beard. However, in Caucasian skin, this does not happen, and therefore in Caucasians, even the cheeks can be harvested with beard grafts. So this is the shadow area of the beard. Very often asked question, why is the cost of body hair almost 2 to 3 times that of scalp hair? Well, there are a number of reasons for this. Number one, very few doctors do it. It requires a lot of skill training and also dedication because it's a laborious task, a back-breaking task. Also, it takes a lot of time to harvest an adequate number of body grafts to do justice to the baldness because most body grafts are present in single or at the most double follicular unit groupings. So it requires that much of an effort to cover an area which using scalp grafts would have been done in a jiffy. For this reason alone, many clinics do not offer body hair because in the time period that they would be doing the body hair, they would harvest 3 times as many scalp hair, if not more. And also the risks, if you are not trained for body hair transplants, are many. If you are not careful, if your technique is lacking, you might also cause a lot of transection because body hair are located in areas where there are underlying nerves, where there are underlying vessels. Also, the orientation of grafts is very acute, that it is flush with the skin. Harvesting it can lead to high transaction rates if one is not adept in the method of body hair transplants. And in cases like these in which the vole pattern is opposite to what we expect, due to the restraints of the bony contours, it becomes very difficult to harvest beard grafts which keep changing direction under the shadow area of the jawline. So due to its being a complex procedure requiring back-breaking surgery and early fatigue setting in, the cost is bound to be higher. The surgeon and his team need to be compensated more than for scalp grafts, and that is the reason why the cost of body hair transplant is higher than the cost of scalp hair transplants. Harvesting body grafts is quite difficult if you do not have a lot of cases under your belt. And this is because the skin is very lax. It's not like the skin at the back of the head which is stretched out because of the skull bone underneath. This skin needs to be continuously stretched manually or by increasing the turgor under the skin by use of tumescent fluid. Also, the arrangement of follicles in the follicle unit is quite spread out. It's not compact. At times, the distance between two follicles in a follicle unit may be even as much as 1.5 to 2 millimeters. And this definitely adds to the difficulty of harvesting, and therefore that's the reason why many clinics do not do this procedure. All patients who want full coverage of their extensive baldness in just one sitting are the people who are advised body hair transplant and are the people who opt for body hair transplants. However, a small percentage, about 20% of people with extensive baldness, when explained the options, will opt for a staged procedure in which the frontal area is done in one session and the back of the head or the crown area is done in the second session anytime after 6 months have transpired. I have seen that whether a patient opts for body hair or just wants to utilize scalp hair depends a lot on how well he has been explained the procedure and how much confidence he has in the surgeon who's doing the procedure. Over an exclusive career in hair transplant surgery over the past 17 years, I have 11,000 procedures of body hair transplant, chiefly from the chest and the beard. And these are the procedures I have done myself, because in my clinic, our model is that I do all the surgical steps myself. So these are not the cases done in my clinic, but these are the cases I have done myself. If you watch my video on DHT paradox, you will realize that though DHT is a trash hormone for scalp hair if you have the balding gene, body hair thrive very well in an environment replete with DHT. So body hair do not need finasteride to thrive. Now beard hair will grow even longer than scalp hair. Just a visit to a mosque or a gurdwara, you will come to know that beard hair can grow up to 1.5 to 2 feet in length very easily. And it remains this length even in old age when scalp hair begins to shorten. However, this cannot be said about other bodily sites from where body hair grafts can be harvested, like the chest or the torso, but beard hair grow longer than scalp hair. If you have a good amount of scalp hair in your donor area, that is the path that you should take for your hair restoration. But if any of these points are true, in consultation with your doctor, you may like to augment the number of grafts by using body grafts taken from the beard, the chest, or from some other locations in select individuals. When I started my career initially, I thought that hair taken from the nape of the neck are soft hair, and these can be used for the hairline. These can be used for the temple points to give it a soft touch, to give it a much more natural feel. However, over the years I've learned that these hair, when planted along the hairline, grafts taken from the nape of the neck, that's the lower neck, fall off with time. Why does this happen? Because as we age, the hair in the lower neck disappear with time. Therefore, as we age, the hair that have been transplanted to make your hairline soft will also fall off, negating this procedure. So now usually I do not do this procedure. Yes, hair can grow anywhere, wherever they can be transplanted. But to tame beard hair is a Herculean effort. They are thick, wiry hair. They have their own mind. Even with grooming these hair over many years, the hair will be very difficult to tame. And therefore these hairs are not used along the temple points, not used along the hairline, the leading edge of the hairline, and definitely not in the crown area at the back because they stand out. So the best areas to use beard hair for volumizing is behind the first few rows of the hairline and the mid scalp. There are other uses for beard hair like FUT scar, very rarely FUE scars, and in other scars located over the scalp. The healing and recovery of body hair is much faster as compared to the scalp hair because these locations have loose skin and loose skin, when it heals after the punches have been scored and the grafts taken out, by a process of wound contraction, it closes up very, very fast. Also, there is no need to hide these areas because most of these areas are concealed pretty well with clothing. Yes, a wet pre-shave procedure is ideal before a hair transplant procedure when you're taking grafts from the body. And this is best done 36 hours to 2 days before the procedure because a lot of body hair are in the resting phase at any given period of time. And therefore, to make out anagen hair from these hair, which though are obvious, though can be seen, may be in the terminal anagen phase entering the catagen and telogen phases. And therefore, if you transplant them, the growth, the percentage of growth, the survival will be lesser. So therefore, to target anagen hair, which are in their most florid state of growth, it is important to pre-shave the area about 36 hours to 2 days before the procedure. Wet shaving is shaving the beard or the chest or other parts of the body from where body grafts are being harvested using shaving cream, and the method of shaving should be against the grain, not along the grain. I have found that the theory of recipient dominance is mostly fake. It perhaps was used to sell body hair transplants when they first came out, when there was a lot of question about the characteristics, about the different nature of body hair as compared to scalp hair. To sell these procedures, they said that once body hair are transplanted onto the scalp, over a period of time, they assume the characteristics of the scalp. And they said that this happens because scalp hair or the skin around the scalp hair signals these follicles to change their basic characteristic. Bamboo planted in a field of sugarcane will remain bamboo and not be found dripping of sugarcane juice one fine morning. Oak trees have subsisted with pine trees over several centuries, but they haven't changed their unique characteristic. And nature does not differentiate the scalp from the forest. And I have been following my patients over several years now, and I have found that body grafts, which I did about 10 or 12 years back, have not changed their basic characteristics over this period of 1 decade. They still look the same. If they were taken from the beard, they still look like beard grafts. If they were taken from chest, they just look like chest grafts. Nothing less and nothing more. There is so much of truth in the donor dominance theory. In fact, the whole procedure of hair transplant revolves around this basic surmise that grafts taken from the scalp area, when transplanted into the recipient area, will retain the unique characteristics and not be susceptible to DHT. Because it is the seed that is important, not the soil it is being planted in. And this is completely opposite to the theory of recipient dominance. As far as recipient dominance is concerned, there are some surgeons who have reported that when body hair, say taken from the beard, is transplanted to the eyebrow, over a period of time they have noted that there is a little bit of thinning and a little bit of decrease in the speed of growth of beard grafts in an attempt to match the speed of growth of eyebrow hair and the unique characteristics of eyebrow hair. But I do not think that this is so significant as it is made out to be. However, this requires more research, and if true, it will open up a Pandora's box of the possibilities in hair transplant surgery. This is a curiosity that needs to be researched, since it can be leveraged by the hair transplant surgeon in several situations. Just doing beard hair transplants without utilizing scalp hair in grade 6, grade 5 male pattern baldness might not serve the purpose, because these hair are very different in characteristics. They are very strong terminal hair. They will look out of place, weird in fact, downright ugly, because the unique characteristics are very, very different from that of scalp hair. Yes, body hair taken from other locations like the chest or other locations may look more natural, but the result, the outcome will not be as what the patient sought out to achieve. There will be very minimal coverage and density would be compromised in a big way. Yes, by all means you can utilize only scalp hair, but in so doing, if you're extensively bald and the number of hair at the back, the donor area, is less, you may need 2 to 3 sessions to achieve the same coverage which you could otherwise achieve by utilizing scalp hair along with body hair. No, not for body grafts. You do not need finasteride for body grafts because, as said earlier, body grafts thrive in an environment of DHT. But when they're mixed with scalp hair, you might need to discuss this with your doctor. No, definitely not, because the hair that are taken from the body will look little weird, quite ugly, if you transplant them in isolation. That is, if you do not mix them in an adequate ratio with scalp hair so that they lose their unique characteristics. So it is not advisable to use only body hair for covering bald areas. Yes, this is very common nowadays because many times we cannot access the shadow area of the beard or the chest, because getting laser hair removal for the chest and for even the upper neck is becoming very common nowadays. And therefore, in patients who have extensive baldness, this option in those patients who've got it lasered off is not there. So I will advise you to wait till the age of 25 at least before you decide on getting your chest or your upper neck lasered, because at 25 we'll be able to make out better whether you're heading for extensive grades of baldness or not. If it is a lower grade of baldness, like up to grade 4, just the use of scalp hair will suffice. Yes, when body hair are mixed in the right proportion, in the right ratio with scalp hair, and when they are planted according to the hierarchy of positioning, they will look completely natural and will blend in with scalp hair. So let's talk about the hierarchy of placement. Where all do you put body hair and where all do you put scalp hair? Well, scalp hair can be put anywhere because it's the same as that one expects to see on the head. But as far as body hair is concerned, their hierarchy is different. Especially beard hair cannot be put in the leading few rows of the hairline. It can never be put on the temple points, nor can it be put in the vertex or the crown area, because it is difficult to hide their unique characteristics, the most important of which is that they cannot be tamed easily. Beard hair are 2 to 3 times thicker, coarser, and as I said, difficult to tame, even after repeated grooming for many years. No, all beard hair are not the same. The beard hair in the center are coarse, thicker, up to 3 times as compared to scalp hair. But as we go onto the edges, the fringes, towards the neck, towards the back of the cheek, towards the front of the cheek, the lower neck, their coarseness becomes less, their thickness becomes less, and they more closely resemble scalp hair. These hair on the fringes of the beard are most suited for eyebrow restoration. The anagen-telogen ratio is given in the chart here. A diagnosis of telogen effluvium is arrived at when more than 25% of hair are in the telogen phase. The hair cycle, as you all know, is divided into 3 phases. Number 1, anagen phase. Number 2, catagen phase. And the third one, the resting phase or the telogen phase. The anagen phase lasts for about 2 to 8 years. The catagen phase for about 2 to 4 weeks. And the telogen phase or the resting phase lasts for 2 to 4 months. Normally speaking, 78 to 90% of hair are in the anagen phase. Anagen desynchronization is a very vast topic and I have covered it in this video. Please refer to this if that is a question you would like to know about body hair, about scalp hair, about anagen desynchronization. We can ensure very well synchronized hair growth by utilizing pre-shaving method, as we've discussed before. Initial hair growth that we get is closely synchronized because we have subjected the body hair to pre-shaving. So they are more or less in the same cycle of growth when harvested. But this synchronization lasts for only the first few cycles, after which a phenomenon of desynchronization kicks in, till it corrects itself over time. This is not to be misconstrued as a failure of hair transplant. This is a natural biological process because every hair that you pick up from the scalp donor has been picked up at a different time while in the anagen phase. Hairs found in the early anagen phase and in the late anagen phase or the catagen phase are unsuitable for hair transplant because they are finer, they are more fragile, and hence their transaction rates are higher. More body hairs are in the telogen phase than in scalp hair, and also the anagen phase is shorter, just a few months as compared to scalp hair, which is in a couple of years. This adverse anagen-telogen ratio can be tinkered with by the hair transplant surgeon to increase the yield of anagen hair while harvesting. Pre-treatment by pre-shaving is one method. Pre-treatment with 5% minoxidil starting 3 months before the hair transplant is another. By using minoxidil, more hair come into the anagen phase than in telogen phase, and this aids us, assists us in getting a better yield of grafts. Moreover, minoxidil increases the linear growth rate, increases the hair shaft diameter, besides prolongation of the anagen phase of the hair cycle. Hypopigmentation of the extraction site in the donor area may occur, especially so in darker skin, and hence beard grafts are taken from the shadow area. And the chest grafts are taken between the 2 mounds and never over the sternal area or the central bone. Since keloid formation is not too infrequent when you create an extraction wound over bony prominences, and the sternum or the central bone of the chest is very prone to hypertrophic scarring, and more concerning is keloid formation. In those patients who give a strong history of keloid formation or hypertrophic scarring, an initial test grafting can be done, which can be evaluated in about 4 to 6 months, and then the full procedure, the full harvesting can be done after making sure that there is very little risk of the patient running into hypertrophic scarring or keloid formation. Other complications include folliculitis, include ingrown hair and buried grafts which can lead to cyst formation. Awareness of local anatomy, especially facial anatomy, the location of various nerves and vessels is of utmost importance when harvesting body hair from the beard, because motor nerve damage, though infrequent, has been reported while harvesting. This is very rare in expert hands, and especially plastic surgeons who know facial anatomy because they have dealt with deeper tissues. It has been seen that an FUT scar which is supple and which is less than 0.75 millimeter in width becomes less visible by 60% to 75% after adding grafts to it, and usually 300 grafts in such cases is sufficient. And preferred grafts are from the beard. And I have over the years discovered that there is another benefit to transplanting hair into scar. The scar tissue diminishes and it becomes supple after transplantation has been done, after hair taken from another location have been fed into the scar. Now, how does this happen? Because hair carry with them stem cells, and these stem cells transform the scar tissue by better modulation. By better modulation, if the procedure has been done within 18 months of the FUT procedure. And these are fascinating aspects to me as a hair transplant surgeon. While body hair from beard can grow at a much faster rate than that in the scalp, hair from other sources of the body have significantly fewer hair. While harvesting grafts from other sources of the body, these locations have fewer hair in the growing phase. 78 to 90% of the hair on the head are in the anagen phase at any given time, whereas 50% of hair over the chest or even the beard are in the anagen phase. This can make it more difficult to ensure the right anagen-telogen ratio that is optimal for getting suitable outcomes after hair transplant. The availability of donor hair in these areas is much less as compared to scalp hair. The scalp donor has about 6,000 grafts that are available over a lifetime, while the beard hair has about 3,000 in a lifetime, and the chest hair about 1,000. With a shorter growth stage and a longer resting phase, it means that the body hair are shorter in comparison to scalp hair. If a procedure used only body hair from its donor area, up to 50% of hair will fall out at once given the different growth cycle. This would cause bald patches to reappear after the transplant, producing unnatural results. The likelihood that the hair will start to grow curly after hair transplant increases as well, since this is a typical growth pattern of body hair. It is also not a suitable hair for the hairline because it is more firm, more rigid than the thinner and softer hairline follicles. The appearance would be very unnatural, and so again a hair transplant procedure only with body hair would not be possible. With chest hair, the difference in tissue compared to the scalp means that a larger hollow needle or a larger punch is required and more scars will be left behind. So that was a talk about utilizing body hair, body grafts for high grades of baldness. The pros and the cons, where you can use body hair and where you cannot. What are the medications that you have to take when you use body hair? How natural they look, and what are the limitations of body hair? If you have any questions about body hair transplants, about any aspect about hair transplants, about hair loss treatment for men and women, do let me know and I'll be there to help you. If you haven't subscribed, please do. Your encouragement keeps the channel going. Have a nice day and God bless you.